Okay. Um, in this particular video, I want to discuss the autonomic control of heart rate. Before watching this one, I created two videos prior to this, one on the cardiac syncytium and cardiac muscle action potentials. And then I created another one on the cardiac conduction system. I strongly recommend you watch those two before diving into this one. Um, whether like I always say, whether it's my videos or someone else's videos on those two particular topics, just because it'll just make this stuff a lot more easy to understand, and you'll have a better appreciation of what I'll be talking about in this video. So again, make sure you cover the cardiac syncytium and the cardiac conduction system first. All right. Also, I just want to give a heads up. I'm doing this. My old headset with the microphone kind of conked out on me, and I just got a new pair today. So this is the first video with the new set. So if there's any audio issues while you folks are listening, please let me know immediately so I can make the right adjustments. So on that note, let's get cracking. So first, I want to talk about just some basic terminology that will relate to this, and then I just real quickly these next two bullet points. I just want to spend a little bit of time reviewing the autonomic nervous system and the cardiac conduction system, just in case it's been a while since you looked at those topics, because there's going to be a lot of there's going to be a lot of knowledge from those two subjects involved with this particular discussion. So it's important that, again, even if you have gone over it before, that we refresh kind of the important parts of those topics. And then I'm not going to go into an extreme in-depth discussion about this, but there are some basics that you need to know about the ANS, the autonomic nervous system innervation of the heart. And then we'll talk about the parasympathetic versus sympathetic effects on the heart itself and the basically the electrophysiology effects that they have on the heart. So on that note, let's get continue. So terminology. So autonomic nervous system. This is a division of your peripheral nervous system that basically regulates the automatic functions of your organs, hence the term autonomic. I mean, whenever I hear the word autonomic, I mean, it sounds almost exactly like automatic. So that's what I think right away. So basically, as I just said a second ago, this division of your nervous system regulates the activity of the mainly your viscera, other areas as well, but primarily viscera, your organs. Um, like I said, remember I said the word automatic a second ago. Another word for automatic would be unconscious. So basically, this is a division of your peripheral nervous system that is unconsciously keeping you going, like making adjustments to heart rate, making adjustments to breath rate, making adjustments to your digestive system, how much blood is being distributed to various organs throughout your body, pupillary constriction or dilation. All of that is automatically adjusted by this particular nervous system. And you can probably get the picture that we're going to be spending our time talking about how this system affects the heart. And remember that there are two divisions of the autonomic nervous system, the sympathetic and the parasympathetic nervous system. And these two systems antagonize one another. And a little terminology review. Remember, antagonize means to work against. All right. So basically, one of these divisions carries out one type of actions, the other carries out another type of actions. Now, the sympathetic nervous system, I like to think of as increasing activity. Basically, this is we engage the sympathetic nervous system more when we are in situations of stress, like you're walking through the woods and you encounter a bear. And basically, all of a sudden, your heart rate goes up, your breath rate goes up. It seems like your vision gets better. And then all of a sudden, you have a situation here. You either have to fight or you have to outrun the person you're hiking in the woods with. Haha, that was a joke. But you get the picture. So the sympathetic nervous system basically uh, allows the body to adjust to stress. So you can get out of that stressful situation. And being the animals that we are, we're no different than any other animal. There's two real ways to get out of a scenario: fight or evade it. Also, this is the sympathetic nervous system is basically allows us to make the right preparations and adjustments to exercise as well, which is stress on our physiology, but a more positive form of stress that has many, many health benefits. So the sympathetic nervous system basically is going to enhance physiologic activity and also reroute blood flow away from your viscera, especially your abdominal viscera, to your skeletal muscles. So I mean, a good chunk of your cardiac output will be going to your muscles, which I'll talk about much later on in other videos. And then the parasympathetic nervous system does pretty much the exact opposite. All right, pretty much does the exact opposite of the sympathetic nervous system. So basically, the activity of the parasympathetic nervous system, which is probably 90% dominated by the vagus nerve. Remember, cranial nerve number 10, vagus, Latin for wandering, because cranial nerves are typically isolated to the head, minus the vagus nerve. But the parasympathetic nervous system does basically the opposite, allows the body to recover from stress, kind of slows everything down. It's like the equivalent to hitting the brake pedal on the gas. So let's talk about something stressful, driving in the state of Minnesota. Um, it's just people drive differently than from where I grew up in Wisconsin. And quite a few times I've had to hit my brakes. I get, it's one of the few places I get kind of ticked off real easily is when I'm driving. And, or if someone tails me for a long time, I don't like that. So my sympathetic nervous system is kind of get my heart rate up, preparing me for something stressful, and then when the stressful situation goes away, then your heart rate comes back down, and your breath rate goes back down. You become more relaxed. So I like to think of this as kind of slowing down the bulk of your physiology, allowing you to recover from having to deal with the stressful scenario. Um, and also is very important for the unconscious digestion and motility of food. So even though the parasympathetic nervous system tends to slow most of our physiology down, it tends to increase the activity of our GI tract. All right, but again, that's a topic for later on. We just need to review that. And then a couple other terms you're going to see here: chronotropic versus dromotropic. Basically, these are the effects that the autonomic nervous system has on the cardiac conduction system, and these can be either positive or negative. Now, when you see the word chronotropic, you're going to think the SA node, okay, the SA node. And then when you see dromotropic, you're going to think the AV node. All right, and remember that concept of dual innervation that the autonomic nervous system, for most, not all, but most organs of the body, has both sympathetic and parasympathetic fibers innervating organs at the same time. I mean, an exception of that would be blood vessels, for example. Blood vessels are only innervated by the sympathetic nervous system. But basically, there's a constant stream. If we think of an organ like the heart, there's a constant stream of firing from both divisions of the system to the heart. But obviously, one of these has to be more in control of the heart. We'll talk about that later. But the beauty of this, of having sympathetic and parasympathetic fibers innervating organs at the same time, this allows us to make very, very snappy, rapid adjustments when the time is right. I mean, you guys know that when you're driving down the road and someone is driving like a bonehead and they cut you off, I mean, it's within a second your heart rate is up. You feel like you're breathing more. You're white knuckling the steering wheel, and then after that person goes by or you see him get pulled over and you're all happy or whatnot. Again, it only takes, I mean, within a matter of seconds, and all of a sudden you're already starting to calm down again. All right. So you have to keep that in mind. So when you see chronotropic, you're going to think the effects of the ANS on the SA node, and then dromotropic, the effects of the ANS on the AV node. All right. And just a little more review on the specific terminology with the autonomic nervous system. We would say that the sympathetic nervous system exerts adrenergic effects, which again are those excitatory effects. And let's keep this focus on the heart here. Um, so the adrenergic effects would be because, remember, kind of we have to take this a step farther. So we have two sets of nerves innervating the same organ. Well, they're releasing, how do they elicit different activities? Remember, that has to do with the neurotransmitter that is the different neurotransmitters that are secreted, and the receptors that those transmitters interact with. And remember that the primary postganglionic neurotransmitter um, of the SNS is, yeah, pardon my technology here, is norepinephrine. All right, norepinephrine. And when we're talking about the heart, norepinephrine is going to interact with beta 1 receptors. Okay, beta 1. So norepinephrine plus beta 1 equals an increase in the activity of the heart. So increased heart rate, increased cardiac output, and an increase in blood pressure. All right, and we'll talk more about that in a little while. Um, again, for these fight or flight scenarios. And the parasympathetic nervous system is going to be pretty much the exact opposite. All right, we are, remember that the primary postganglionic neurotransmitter here is going to be acetylcholine. All right, and then when we're talking about the heart, it's going to interact with muscarinic receptors, specifically M2 receptors. All right, and these receptors will elicit an inhibitory effects on the heart. All right, so it'll slow the heart down. All right, and that's what we would call a cholinergic effect. Um, all right, which allows us to recover and relax. All right, now, um, one thing I did want to mention as well is, well, let's talk about this for a second. So I said on the previous slide that the heart is duly innervated by both sympathetic and parasympathetic nerve fibers. So we'll say parasympathetic and sympathetic. So then the question you should be asking yourself is, well, which one of these two divisions of the autonomic nervous system is in control most of the time? Because most of the time we're in a state of rest. You're sitting at home studying and watching TV. You're in class trying to relax and not stress yourself out, and listen to a teacher. Your driving's a little more stressful, but not for everybody. You were normally in a state of relaxation, unless, I mean, there are people out there that are high strung alpha people, soccer moms, whatever, just dramatic people that are constantly stressed all the time. But the average person is normally in a physiologically is in a state of relaxation. So the parasympathetic nervous system is primarily in control of the heart rate, and then basically in a situation of stress, we increase the outflow from the sympathetic nervous system to the heart, which basically overrides this until the stressful stimulus is gone, and then that's when the parasympathetic nervous system would kick in again. All right, so that's your ANS review. And remember the cardiac conduction system. It's important to kind of go back over this again. Remember that there's a handful of structures in the cardiac conduction system. The SA node, sinoatrial node, um, which is located in the upper portion of the right atrium. All right, and then we've got an AV node with a bundle called the bundle of His that projects into the IV septum, and then bifurcating from that bundle of His would be the bundle branches, and there are two branches, one for each ventricle. All right, and then projecting from the bundle branches, innervating the myocardium of the ventricles and the papillary muscles would be Purkinje fibers. All right, and remember that there is a certain, that this is the part of the heart that allows for that property of, automaticity or autorhythmicity. Remember, automatic. The heart automatically beats. All right, and then remember that the SA node is the portion of the system that depolarizes at the fastest rate. So remember that all parts of the conduction system have their own inherent rate, this oscillating rate of depolarization, repolarization, and whichever part of the conduction system basically depolarizes, repolarizes the fastest, that is the part that will basically pace the heart. And the SA node is the portion of the heart that depolarizes and repolarizes the fastest. So as a result, basically all the other structures of the conduction system can't do this on their own, because the SA node is firing too fast. So all the rest of the parts of the system kind of succumb to the firing rate of the SA node. And remember that your direction of the conduction going from the SA node, um, going from SA node to AV node, down the bundle branches, um, and then down towards the apex of the heart. Remember that this is a right that the impulse travels in a right to left fashion. The begins here, goes to the left, and then obviously goes around the ventricles as well. All right. So basically, what you're going to see here in a second, the autonomic nervous system basically primarily innervates the SA node and the AV node. All right. And then the sympathetic nervous system also innervates the ventricles. All right. But you can get the picture. This is a video about how we make adjustments to heart rate, basically increasing or decreasing it. Well, the way to do that is to increase or decrease the firing rate of the SA and the AV nodes. If we increase the rate, well, then heartbeat's going to go up. If we decrease the rate, then heartbeat's going to go down. All right, you get the picture. But again, you have to understand, again, those basic principles of overdrive suppression, the order that the structures fire in within the conduction system. All right. So like I said, if you're watching this video before going over the actual conduction system with more depth, stop and go back and learn about that. Because like I said, it's just you just won't this just won't make a lot of sense to you otherwise. All right, so let's talk about basically how the parasympathetic and sympathetic nervous systems innervate the heart separately. Even though I mentioned a second ago that both these systems duly innervate the heart, so there are both parasympathetic and sympathetic fibers going to the heart. Like I said, we're going to talk about these separately. So first off, the parasympathetic nerves that innervate the heart originate from the dorsal motor nucleus of the medulla oblongata, the via, and then the nerve that projects towards the heart is the vagus nerve, which, as I mentioned a second ago, makes up about 90%, of the entire parasympathetic nervous system. And this is a cranial nerve that wanders from the skull and travels all the way down to the abdomen and innervates pretty much all the viscera along the way. The heart, the lungs, your larynx. I'm sorry, your larynx. Some of your pharyngeal muscles for swallowing. What else am I going to say? Your lungs, your heart, stomach, pancreas. There's a lot of their liver. This nerve innervates your intestines, a lot of these organs. And that's what the word vagus means. It means it's Latin for wandering, because remember, most of the cranial nerves are isolated just to the head and the neck. All right, this one definitely travels the farthest. Um, all right, and then it synapses with these intramural ganglia, and then, like I said, the postganglionic fibers innervate the SA node, the AV node, and the atria. Now, the vagus nerve primarily affects the two nodes of the conduction system, and basically slows down their activity. All right, and the result of that, of a decrease in the activity of these, would be a decrease in cardiac output, blood pressure, ultimately because of a decrease in heart rate. All right. So what we have here, so this would be the medulla oblongata. All right. And again, there's a lot more to talk about with this, in terms of, I'm only just talking about for the sake of this video, just the vagus nerves going to, from the dorsal motor nucleus to the nodes of the heart. And remember that parasympathetic nerve fibers have very long preganglionic nerves and then very short postganglionic nerves. And that's what the dashed lines represent, the postganglionic neurons. All right. And basically these the vagus nerve, as I mentioned a second ago, innervates primarily the SA node and the AV node, and then there are some collateral branches that extend from the vagus nerve on the way down that innervate the atria, and then also innervate the lungs and the bronchi and the lungs and whatnot as well. All right, but like I said, the vagus nerve predominantly or primarily affects the nodes. All right. And like I said, the vagus nerve is also primarily in control of the heart for most of the day, unless you are exercising or doing something that's stressing your physiology. So we would say that the vagus nerve exerts something called vagal tone. Vagal tone. All right. So what tonicity is, you have to remember, when we say tone, we're talking about a constant a constant outflow, a constant stream of action potentials to the heart. So the vagus nerve is constantly, generating action potentials to the heart, keeping heart rate low. Like I said, unless we're in a situation where we are stressed out, then the sympathetic nerve, the sympathetic fibers that innervate the heart, we would have a much stronger outflow from them, which would basically override and counteract the activity, this vagal tone, all right, the activity of the vagus nerve. And the stronger the outflow from the vagus nerve to the heart, the slower heart rate is going to be. All right, plain and simple. And now again, this could be dangerous, because if our heart rate drops too low and our cardiac output drops too low, then that could lead to us, fainting, going unconscious. Like, I'm assuming you've heard of something called vasovagal syncope when people faint or pass out for specific reasons. I'll talk about that later on, but you get the picture with the vagus nerve, and then the sympathetic fibers that innervate the heart originate from the region of the spinal cord from T1 through T4. And then the postganglionic neurons travel from the sympathetic chain. Remember those basically those paravertebral ganglia that are traveling parallel with the spinal cord, from about the upper thoracic, lower cervical, all the way down to the, upper lumbar vertebrae. All right, and then as I, mentioned before, the sympathetic nerve fibers innervate the SA node, the AV node, and the myocardium of the heart, more specifically the myocardium of the ventricles. All right. And again, you can get the picture here that when we increase sympathetic outflow to the SA and AV node, that's going to speed things up. That's going to increase heart rate. And when we increase sympathetic outflow to the myocardium of the ventricles, well, that's going to increase the contractility of the heart. So basically, what I'm saying here is it's going to increase the force, all right, the force of contraction. And the harder the heart squeezes, the more blood that's going to be pumped out of it. So again, an increase in cardiac output, the amount of blood circulated out of the heart per minute. All right. So that's something you have to keep in mind. And so, like I said, normally if this were, a normal picture, we would also see, fibers coming in from the sympathetic, nervous system going into all these at the same time. But that would just get a little complicated. Um, so you get the picture here. Sympathetic, parasympathetic fibers innervating the heart. And let's talk about the more specific effects on the electrophysiology of the heart here. Um, so again, we'll talk about these separately, the SNS and the PSNS. So the sympathetic nervous system basically increases the firing rate of the SA node. And basically how it does this is it basically makes it more permeable to sodium. Remember that the SA node and the AV nodes are a little different in terms of how they generate action potentials, because remember when we were talking about the action potentials of myocardium, there are essentially four phases. Phase 4 would be the resting membrane potential, 0 would be the up spike, the dramatic upswing due to an influx of sodium. And then you would have 2 and 3, which would be the plateau phase, and then potassium moving out, and then you would go back to 4 and then just start all over again. Whereas with these nodes, it's basically we only have phase 4, we have phase 0, and we have phase 3. All right, there's no plateau phase essentially. All right. And remember that during the initial slow depolarization, that's performed by these sodium channels called IF channels. Basically these are funny channels. That's what the F stands for. All right. And basically these are funny because normally when we're talking about action potentials with the myocardium, the muscle tissue of the heart, and also with skeletal muscles and with neurons, the sodium channels that are operable here are very fast. Okay, they're very rapid channels, meaning that when they open fast, sodium moves through them quick, and then they close very quickly as well. All right. Now with these funny channels, they open a lot more slowly, and it takes a little longer for the cell to become depolarized to its threshold. And then these are also goofy because, normally when we're talking about, the whether we're talking about cardiac muscle or we're talking about the action potential of a nerve, whenever you see this big uptick, this depolarization, which is basically what phase zero is, it's normally sodium coming in. But what happens here is, remember that phase zero is the opening of calcium channels. Now, unlike that of the plateau phase of myocardium, these calcium channels are very rapid. Um, Whereas the calcium channels with the myocardium are much more slow, hence the plateau phase. Um, and also there's other factors that contribute to the plateau phase, but that's one of them. All right. So basically, once we depolarize to a threshold, then calcium ions will rapidly move into the cell, and then basically, phase three would be, potassium moving out, like many other action potential, and then we go right back down, and then we start over again. We'll immediately start going right back over, because once this depolarizes, or I'm sorry, repolarizes down to about negative 60 millivolts, then these funny channels start to open again right away, and that's what essentially creates that oscillating membrane potential, is these opening and closing of the channels based on the electrical changes of the cell. So the sympathetic nerve fibers, when they're exerting their positive chronotropic effects on the heart, what they're doing, as I mentioned before, they are increasing the amount of sodium coming in during this initial phase of depolarization. So as a result, that's going to cause an increase in our heart rate. All right, that's going to cause an increase in heart rate. And then with the sympathetic nervous system, the effects it's going to have on the AV node, it's going to increase conduction velocity by creating an increase in the permeability to calcium. Now let's kind of wind back here for a sec and just talk again about the AV node. Remember, the AV node is important for a couple of reasons. One, it is the gateway between the atria and the ventricles. I mean, remember, the SA node fires, and then that action potential is propagated along the syncytium of the atria, and it'll all those channels will, I'm sorry, that action potential will get channeled down to the AV node. And remember that the AV node has very, very slow operating calcium channels that basically slow down the conduction velocity of the action potential. But that's a good thing, because that means it's going to take a little longer before the ventricles contract, and that gives us a little extra time to fill with blood. All right. Now, if we increase the AV node's permeability to calcium, that means that the AV node is going to depolarize at a much more rapid of a rate, and that's going to increase the conduction velocity from the atria down to the ventricles. And so that means the ventricles are going to pump more quickly. All right. And so when we have the SA node and the AV node both firing at a more rapid rate, well, obviously the ventricles are going to also be firing at a more rapid rate, because remember your concept of overdrive suppression. Remember the bundles and the Purkinje fibers fire at much slower rates than these two. So all in all, heart rate will go up. All right. And the effects of the sympathetic nervous system on the myocardium is that's going to cause an increase in contractility, which will result in an increase in cardiac output and blood pressure. All right. And I haven't talked a lot about cardiac output yet. There's a lot of factors that go into that. But like I said, by definition, cardiac output is just the volume of blood pumped out of the heart every minute. So if we're increasing our heart rate and the force of the contraction, we'll also increase all the other factors that contribute to an increase in cardiac output, and we'll essentially circulate more blood out of the heart to the rest of the body. All right. And that will also cause an increase in blood pressure. Now, I haven't talked about peripheral blood flow or anything like that yet, but you can get the gist for now. And then, the parasympathetic nervous system is the exact opposite. All right, is the exact opposite. So, basically, the parasympathetic, the vagus nerve, innervating the SA node, is going to exert negative chronotropic effects. And basically, by, like I said, doing the exact opposite, decreasing sodium permeability. So it decreases the amount of basically the amount of those funny channels that are in an active state. So it's going to take longer. So this phase 4 depolarization is going to take longer for us to reach threshold and then get those calcium channels opening more quickly. And then it's going to, and then same thing, it's going to take us longer and longer and longer to basically depolarize and repolarize. And um, and so basically, if it takes us longer to depolarize the threshold, about, negative 40 millivolts, then it's going to take longer for these calcium channels to open and then for us to really undergo the fastest parts of the action potential. The other reason why this slows down is because of an increase in potassium outflow. All right, by increasing the activity of what's called the potassium ACH channel. All right, excuse me. All right, so basically, what this channel is doing is it's basically pumping more potassium out of the cell. Now, remember that potassium is the electrolyte that ultimately determines membrane potential of all cells. All right, and so the more potassium that is circulated out of here, the more negative this is going to be. So this is going to become more hyperpolarized as well. So it's going to become more negative, and it's going to take longer. That's another factor that contributes to the length of the phase 4, the phase 4 aspect of from getting from phase 4 to phase 0. All right, so the more negative it is, the longer it's going to take for us to depolarize the threshold. All right, and the effects are going to be, again, with the AV node, these negative dromotropic effects. So negative meaning, slowing things down, reducing activity, similar ordeal here. As with the SNS effects, except just the opposite. So the vagus nerve decreases conduction velocity. All right, decreases conduction velocity. And it does this by decreasing the AV node's permeability to calcium. So the longer it takes for calcium to get into the AV node, the longer it's going to take for that action potential to go from atria to ventricles. And at the same time, if we increase the exact same channels as up here, those, potassium acetylcholine essentially channels, ACH channels, that's going to make it, more negative, and it's going to have a much slower firing rate. And as a result, it's going to slow down, the conduction velocity, and it's going to slow down the rate that signal goes from atria to ventricles. All right. Now, clinically, this is important because this can lead to, too much activity of the vagus nerve on the AV node can lead to what are called heart blocks. All right, and a heart block essentially is, so let's kind of draw our heart. Yeah, that's a terrible drawing, but so let's just say here's our SA node, and then here's our AV node, and then the rest of the system, the bundles and all that. So a block would be when, remember, you should always think of the AV node as a gateway between the atrium and the ventricle. So you can just probably automatically figure out what a block is, when the AV node is blocking that action potential from getting into the ventricles. All right. And there's a couple of different types of blocks, that can occur, first degree, second degree, Wanky box, and so on. There's a handful of them out there. And those are very noticeable on an EKG. All right, so let's just kind of talk about that for a sec. So let's say we've got our P wave, QRS, and then our T wave. All right, so remember your P wave is the SA node firing, the QRS complex would be the depolarization of the ventricles. T wave is repolarization of the ventricles. And remember that the PQ interval is basically this little flat, whoops, this PQ interval you see right here, so flat line, that is basically the AV node holding up the action potential before it gets down into the ventricles. The QRS complex would basically be the bundle branches depolarizing the ventricles, and then the ST segment, remember, is the Purkinje fibers actually stimulating ventricular systole, and the ventricles contracting, and then the T wave would be the ventricles repolarizing and recovering. So you can probably figure out then what would happen if someone, if someone has a block. Basically, let's just say we're talking about a first degree block. You're going to see a P wave, and then the PQ interval is going to be much longer because there's going to be a delay between when that signal gets from the atria down to the ventricles. All right. So that's something you have to keep in mind. And then the parasympathetic effects on the atria are just the exact opposite of the sympathetic effects on the ventricles. It's just going to decrease contractility, decrease the force of blood flow or that atrial kick of blood down into the ventricles, and just overall slows things down. So you can do the math here then. The vagus nerve keeps heart rate low. All right. The vagus nerve keeps blood pressure low. All right. The vagus nerve keeps cardiac output down. All right. So again, the exact opposite of the sympathetic nervous system. And again, this is pardon my art here. This computer's the stylus pen and all that's gonna give me problems. But remember, so if this would be a normal rate of depolarization, repolarization, we would have we would have this fairly slower phase 4, rapid 0, rapid 3, and then we would go right back into it again, and then again, you get the picture. And then so if you were to look at the effects that the SNS has on here, you would see a much more rapid phase 4 depolarization, much more rapid. Um, and remember, if this goes up, then heart rate goes up. And then with the parasympathetic fibers, I should actually draw this differently here real quick. And when we're talking parasympathetic, it's going to take us much longer to get back up to that again. All right. And that will slow things down because remember, whichever part of the conduction system has the fastest phase 4 depolarization controls the heart rate. All right, and which is why it makes sense that the autonomic nervous system primarily exerts its effects on the AV and the SA node, the two fastest components of the conduction system, and basically they exert their strongest effects on phase 4 right here. All right, so you can get the picture. Now, a little more clinical relevance to this, besides talking about blocks, I'm assuming you've heard of beta blockers. All right, which is an antihypertensive, a medication people take to keep their blood pressure down. Well, guess what beta blockers do? They block the interaction of norepinephrine and those beta 1 receptors. All right. So by making it harder for those two, for that neurotransmitter and that receptor to interact with one another, well, that's going to make it harder for the sympathetic nervous system to increase heart rate. All right, because it's going to make it harder for the SNS to exert its effects on the AV and the SA nodes. And as a result, that's going to keep heart rate down. And remember, if heart rate goes down, blood pressure and cardiac output, or I'm sorry, I should say it the other way around, cardiac output and blood pressure will remain low as well. All right. So I mean, so beta blockers disrupt this process. Makes it disrupts the SNS fibers from being able to speed up the heart. All right, and increase the contractility of the heart. Um, I don't know. I guess that's about really all I have to say about the ANS and the heart. Hopefully this helped. Hopefully this was just was primarily just a good review of again your knowledge of the conduction system and those action potentials of myocardium and the nodes and the cardiac conduction system. And but like I said, hopefully you can see the again, I just gave you a couple very minute examples of the clinical relevance of understanding this, but you can get the picture. You can get the picture with this, that there's a lot more importance with this, like calcium channel blockers and beta blockers and whatnot, and so on. So again, if you have any questions, don't hesitate to contact me, and take care and keep working hard.